The government's wellbeing budget is out this Thursday, but don't expect much help when it comes to the wellbeing of your teeth, despite dental care being a big and obvious health problem in New Zealand.
Everybody is dealing with it in some way, and that's why it is the topic for our latest Because It Matters news campaign. National correspondent Patrick Gower has been investigating.
Yes, official survey figures show us that almost half of Kiwi adults don't go to the dentist, 44%, many because they simply can't afford to. That's 1.6 million people. It is expensive, as once you are aged over 18, if you are working, there is no taxpayer subsidy whatsoever and virtually no help for beneficiaries either. That's even though poor oral health can lead to other illnesses such as diabetes, heart disease, possibly even cancer, and it can have a real negative impact on mental health as well. For many, it is a crisis. Take a look at this X-ray. Tonight, we will look at this person's struggles. The dentist. For some, it is known as the murder house. But for Crystal Selwyn, it could be the answer to her dreams if only she was able to afford what she needs.
I hear some cracking noises.
Crystal is a true Kiwi battler. She is bringing up 6 kids on her own and works 5 nights a week as a cleaner at Waikato University. She would like to get a higher paid job, but her teeth are holding her back.
A lot of jobs and stuff that I want to look at is all to do with customer services, and I don't even feel confident to go into a job interview and be like, hey, I want to be your frontline face sort of thing, yeah.
That is because she has a genetic condition that means her teeth are very soft and more prone to decay. It even affects her on the sideline at her kids' sport.
You want to cheer them on as much as possible, but at the same time you're like, you know, sort of thing, but yeah.
She needs work done, lots of it. Every tooth is rotted and needs to be removed. And like many New Zealanders, she has no idea how she is going to pay for it. Based on official average costs from the Dental Association, her examination and x-rays will put her back $152. Scans of her jaw, $182. Gum treatment, $360. Upper and lower dentures, $2,500, a denture reline, $428, and all of the extractions, 20 teeth at $229 each. That's $4,580.
Extractions are very expensive, so I was hoping they'd just fall out and I can go get dentures, but apparently that doesn't work.
All up, Crystal is facing a bill of $8,259. Dentist Asil Russell says it's too much.
For someone like Crystal, it's unaffordable, it's unreachable.
But it has to be done. The pain is unbearable.
The last times that I've had an infection, it has actually swollen half my face up, where I've ended up at the hospital and stuff, and it's looked like I've been sucker punched in the eye.
Asil Russell sees low-income workers like Crystal every day.
For them, it is a crisis. It's a crisis for the way they live and their families, and that impacts their quality of life quite a lot.
She believes the government needs to step up and subsidise dental care for the adults that need it and can't afford it. And Jonathan Broadbent, the leading expert on public dental health, agrees.
Dental problems are among the most prevalent chronic diseases faced by our population.
Poor dental health is proven to lead to other medical problems throughout the body, and increasingly that includes mental health.
I'm feeling very scared that I will soon have not many teeth, and I'm having trouble smiling or laughing and having conversations because of how they look and how people stare at them when I talk.
Asil Russell's inbox is full of messages from patients struggling with depression, brought on or made worse by poor dental health.
If you can't go out and get a job because no one will hire you because your teeth are so bad or you've got bad breath, how are you supposed to feel good and be emotionally stable?
Crystal is keen to move on from experiences like that, and today she has a reason to grin, thanks to the Revive a Smile charity and funding from the Southern Health Cross Trust.
We're going to do all of it for you for free.
Honestly,
so that
oh my gosh, don't make me cry.
So you're going to have a complete smile, and it's going to look great. So I'm very excited for you.
Crystal Selwyn, one of the lucky ones, given a chance to smile again. So Crystal had 9 teeth out. She needs to go back and get another 11 out. And we will be there when she gets her dentures. We will show you that smile. Now, Revive a Smile is a small charity. It relies on donations and can only help 1,100 people a year. Now, free care for all adults in New Zealand would cost $1 billion a year, or maybe even more. Targeted care, say at low earners like Crystal, would be much cheaper. Health Minister David Clark told us there was nothing in Thursday's budget for dental health, and most likely nothing this term. And that is a problem, because this crisis is urgent and worse than many of us think. Tomorrow we go to the front line again and see a 4-year-old boy getting lots of extractions.